Good morning and welcome. We're so glad you're here today, and we promise that this program is worth your time. My name is Janet Milkovich, and I'm the newly elected president of the nonpartisan League of Women Voters of Johnson County. It's my privilege to lead the charge to empower voters and defend democracy here in Johnson County, where our committed volunteers work tirelessly to increase understanding of major public policy issues. Today's issue is the proposed legislatively referred amendment to the Kansas Constitution, which would amend the Bill of Rights. The Kansas Constitution was adopted in January of 1861 and has been amended 98 times in the past 161 years. Why has this critically important vote to change our Constitution been relegated to the August primary election rather than the November general election? Voter turnout for the 21 primary was a dismal 13.61%. Turnout for the 21 general election was over 25%. Think about that. This is a nonpartisan issue. This is a governance issue. Whatever your view on today's discussion, we urge you to vote and get your friends to the polls too. Do not leave this decision up to a small number of citizens. Thank you. And now we'll move on to today's agenda. Here's our plan for today. The first hour will be our panel discussion, followed by an opportunity for you to ask our panelists questions using the chat box. Then we'll move on to our DEI moment and announcements. Our co-VPs, Dr. Andrea View and Connie Taylor, put together today's program. So Andrea and Connie, thank you. And now I'll turn it over to Andrea to introduce our moderator in the program.
Thank you, Janet, for that introduction. I am Andrea View, one of the co-vice presidents alongside Connie Taylor. Connie and I are excited about today's program and the opportunity to learn from our distinguished panel. As Janet noted, we're here to discuss the proposed constitutional amendment that will be voted on by Kansas primary voters in the August 2 primary. Just a background, in April 2019, the Kansas Supreme Court ruled in Hodes v. Schmidt that the Kansas Constitution protects the right to have an abortion. The Kansas legislature subsequently proposed and passed a constitutional amendment that, if approved by a majority of Kansas voters, would state that the Kansas Constitution does not create or secure a right to an abortion. We are here today to educate about why it is important to vote against and defeat this proposed amendment. There is no equality without reproductive rights. Reproductive choice is a dire issue concerning the rights of all people who may become pregnant. The right to a safe and legal abortion is a matter of personal freedom. The League supports reproductive freedom, and as such, this program will focus on why we must defeat this harmful amendment. We now turn to our panelist moderator, Amber Versola. Amber is a Johnson County resident and a member of Kansans for Constitutional Freedom, a bipartisan coalition of reproductive rights advocates and allied organizations committed to protecting the constitutional rights of Kansans to make personal healthcare decisions free from government interference. She will introduce the remainder of her fellow panelists. And with that, I turn it over to Amber Versola.
Thank you, Dr. View, for that. First of all, I'd like to introduce our panels today. The first one is Dr. Alicia Doan. She's the Associate Dean of College of the Liberal Arts and Sciences and the Professor of Women, Gender, and Sexuality Studies at the School of Public Affairs and Administration at the University of Kansas. Dr. Susan Rensing is the Teaching Associate Professor of Gender, Women, and Sexuality at Kansas State University, and she is also a Professor of Social Transformational Studies and a graduate faculty member in the Master of Public Health program at Kansas State University. She's also the vice chair of the board of directors of the Flint Hills Wellness Coalition. Professor Rensing's research areas include maternal mortality, health equity praxis, and the history of reproductive justice in the United States. Rachel Sweet is a campaign manager for constitutional freedom. She's heavily involved in mobilization and engagement to defeat the constitutional amendment, and has been part of work with Planned Parenthood and other organizations as well. So, thank you. So to start us off, let's kind of recap why this amendment is on the ballot. Dr. View provided a wonderful recap of that amendment and the league's position on the issue. In 2015, the Kansas law, Senate Bill 95, attempted to ban people from terminating pregnancy in the second trimester via the most commonly used method. The law would have forced some individuals to undergo invasive and unnecessary procedures against advice from medical experts. The law was challenged in court by Dr. Hodes, and in 2017, the Kansas Supreme Court ruled that the law was unconstitutional under the Kansas Constitution, and that the Bill of Rights in our Constitution guaranteed a woman's right to make decisions regarding her body. So let's start with a few questions here. Sorry. Rachel, can you explain to our attendees why this amendment is on the ballot? What is its purpose and its logic?
Yeah, I can do my best to answer that question. So yeah, as you mentioned, in 2019, the Kansas Supreme Court found that the Kansas Constitution guarantees the right to personal autonomy. This is a broad right that encompasses lots of areas of life, but it includes the right to make decisions about healthcare and the right to choose whether or not to have an abortion. So in 2020, the Kansas legislature immediately moved to try and pass a constitutional amendment to reverse this decision and remove the right to abortion from the state constitution. The coalition of reproductive rights supporting organizations that would later become Kansans for Constitutional Freedom was successful in defeating that measure in the state legislature in 2020. It's a pretty onerous barrier that one has to cross to get a constitutional amendment on the ballot in Kansas. So it requires a 2/3 majority in both the state house and the state senate. But after the 2020 elections, the partisan makeup and just the pro-choice makeup of the state legislature changed significantly. So in 2021, when everyone came back for session, the numbers were just not there to stop this thing from getting on the ballot a second time. So that is why we are here today. And to answer why it is on this particular ballot and the logic, I think there's a cynical answer that I think is true, which is that the supporters of this amendment are counting on a low turnout election. The Kansas primary electorate as a group looks very different than the state as a whole, and it even looks different than the general election electorate, right? The Kansas primary electorate, it has a definite partisan makeup. It is significantly more Republican, it is more conservative, it is whiter, it is older than the state as a whole. So for the supporters of this amendment, they are counting on low turnout, they are counting on low participation, and they are hoping that they can sneak one past the goalie here when Kansans are not voting. So I think that's the logic.
Can some of the other panelists add on to that? Dr. Rensing, possibly talk about what stood out to you regarding this ruling?
Yeah, so I would like to just sort of weigh in on what was unique about this state Supreme Court ruling. So, and y'all can hear me okay, right? I'm seeing my yellow box not lit up. Okay. So, if you're familiar at all with sort of Supreme Court decisions at the federal level, the right to abortion in Roe v. Wade is rooted in a right to privacy. But what is unique about the Kansas State Supreme Court ruling that was issued in 2019 was it was much more unequivocal, right? So the Supreme Court, which I should note, included justices appointed by Republican and Democratic governors in the past. The Supreme Court ruled that the right of personal autonomy was a natural and inalienable right guaranteed by the Kansas State Supreme Court. And so it was kind of included under life, liberty, and pursuit of happiness, and really a very strong argument for bodily integrity as a key component of liberty. And so I think actually a lot of the nationwide press took note that this kind of very forceful ruling came from Kansas, and that Kansans had this right, not a right to privacy to make a decision with their doctor and their family, but instead a right to bodily integrity, a right to bodily autonomy. And so I think that that's important context to note when thinking about changing our Supreme Court through this amendment process, that really Kansans should be proud that the Supreme Court ruling unequivocally said that this was a right of bodily autonomy.
Dr. Doan, did you have anything to add to that? Okay. Well, Dr. Doan, turning back to you, what is the current state of reproductive rights in Kansas? Like, how accessible are the services, and how does the context in Kansas compare to other states right now?
Yep. Well, it's a great question. So the first thing I would start out with is just by reiterating the fact that abortion is an experience that's shared by literally tens of millions of people around the world, and that includes people living in Kansas. And in many regards, abortion care is unexceptional. It's a very much routine part of reproductive health care. And the part that is really exceptional is the landscape, the political landscape around abortion. And in the state of Kansas and across the United States, access to abortion has become increasingly difficult as states have adopted far more hostile laws against abortion rights. So, for example, between 2011 and 2019, states enacted more than 483 new abortion restrictions. And that really accounts for about 40% of all abortion restrictions that have been enacted in states in the decades following Roe. The South and the Midwest are the ones that have had the largest share of these new restrictions put in place. So we don't see a geographical an even distribution of these restrictions across the United States. Specific to Kansas, in terms of access, most Kansans live in counties that have no abortion clinics. So about 98% of Kansas counties do not have a clinic. And in those counties, 61% of all Kansas women live in those counties. So even though abortion is currently in Kansas legal, it's safe, it's not necessarily accessible to many people. On top of that, Kansas has passed a battery of anti-abortion restrictions that has also made the logistics of obtaining an abortion far more onerous for people. And I won't go through all of those. I'll just highlight a couple of those restrictions that have taken place. One of them includes state-directed counseling, and that includes providing people with information, oftentimes misleading information that's designed to discourage them from having an abortion, a 24-hour waiting period. There are restrictions on a person's ability to use their insurance to help fund an abortion. There's also restrictions on the use of telehealth medicine, and that is really significant, and particularly in the context of the pandemic, where we have seen many people turning to telemedicine, and that's become something that has really opened up access to healthcare for people. But yet in the case of abortion, access and the use of telemedicine has really been restricted. And so again, even though it's an unexceptional part of healthcare, it's really treated in law and in Kansas as something that's quite exceptional. There's also restrictions on the time of an abortion, so performing abortions after 20 weeks is illegal in Kansas. And even though, and this is based on this faulty idea that the medical community has rejected, that a fetus can feel pain at that point in the pregnancy. And again, there are a whole battery of other anti-abortion restrictions that have been passed in the state of Kansas. One of the things to note about that is by passing these restrictions, one of the things that it does in terms of creating additional logistical barriers for people accessing it, and it conflicts with very sound public health policy. It really has not altered the demand for abortion or the rate of abortion. So these restrictions have definitely had an impact in particular on abortion clinics, but not on the demand for abortion or the need for abortion care. Turning to your second question about the context, and I'm sure that our other panelists will have much to say about this. The context of abortion in Kansas. So in Kansas, the public opinion towards abortion and support for abortion continues to be, there's majoritarian support of abortion in Kansas. And that has not changed. It really has changed very little. And as I said earlier, what has changed is the political landscape in Kansas has changed significantly. And there are a variety of reasons that we can, talk about as a panel or in the Q&A. But one of the things that has happened is that as the pro-choice movement really in the 90s, the 1990s and the 2000s really started to focus their attention a lot more on national politics. One of the things that happened is that there was a vacuum left in many states, including Kansas, and the Midwest and South has been hit particularly hard. And so in those states, what has happened is that a lot of the debate and support around abortion has been conceded to the anti-abortion movement, where different groups have become really active and very strong in states, including Kansas. Kansas has a very strong anti-abortion movement that really started to take root in the 1990s. And there have been some really important strategic changes that the anti-abortion movement in Kansas has ushered in. And so one of those kind of significant shifts was that prior to the early 2000s, the anti-abortion lobbyists and movements and activists in the state of Kansas were always supportive of Republican politicians who had a anti-abortion standpoint. But one of the difficulties that emerged is that in the state of Kansas, which up until fairly recently was considered a moderate state, they had difficulty with moderate Republicans. And so they shifted their tactics away from that. Instead of supporting politicians once they were in office, they started to really kind of start identifying candidates or potential candidates who were already anti-abortion, so that there wasn't any compromising or convincing that needed to happen once that person was elected. And so one of the things that also happened to, again, a strategic shift to get people in place, to get really staunch anti-abortion elected officials in place, was the shift to focusing on primary elections. We've already talked about that in terms of the fact that very few people show up to primary elections. And if you are a single issue voter and something you're very passionate about an issue, you are much more likely to turn up and vote at a primary election. It also doesn't take a whole lot of money to put into a primary election to really have an influence on the outcome. And so that was one of the shifts that happened as well. And on top of that, we had an election where Sam Brownback was elected as governor, and it was a very welcoming audience for the anti-abortion groups in Kansas, so Kansans for Life in particular. And we saw a significant ushering in after 2010 of dozens of anti-abortion restrictions that were passed in the state of Kansas. So really there was quite an onslaught of anti-abortion bills. And in terms of the context, I want to just point out two things. I'll let other panelists jump in here. The context of abortion in Kansas and what has happened with many of these anti-abortion bills is that they have promoted this narrative. And this narrative, not only among society in Kansas and the public, but also in terms of codifying laws that socially construct women as uninformed, constructs them as a dependent group that's in need of protection from the government to protect them from their own ignorance. And these bills also construct abortion care providers as an unethical group of healthcare practitioners and providers. And one of the big consequences of that, and what we see in our context here in Kansas, is that the stigma around not only talking about abortion, but supporting abortion rights has really increased. There's a very hostile environment to speak up for reproductive rights. There is shaming of people who do so. There is shaming and targeting of elected officials who are not staunchly anti-abortion supporters around to everyday people who, just regular people who do believe in abortion care and that abortion care should remain legal. And it's really led to this veil of silence around the issue. And that also then has this reinforcing perception that most Kansans do not support abortion rights. So I will stop talking there.
Does anybody have anything to add to that? I know, Rachel, you've done a lot of work and you're the public policy director here in Kansas for Planned Parenthood, and you've seen a lot of this head on in the last few years, especially. I imagine you have something to.
Yeah, for sure. No, I mean, Dr. Jones spot on. Everything she said is super true. It's been, I think the situation we're in now in the state where we have allowed this like huge erosion of power and of organizing capacity to happen really did start in the 1990s when conservative special interest groups, including especially in Kansas, the anti-abortion lobby, but also like other groups as well, really did start like running this great ground game, like really targeting like precinct committee seats and just building this grassroots infrastructure from the ground up, which is great. But yes, as progressives and, Democrats generally turn their attention to like national politics, conservatives knew that the real game was in the states. So there's a lot that needs to be done to correct that. I think that's like definitely something that Kansas for Constitutional Freedom is working on doing, trying to rebuild that grassroots infrastructure. But what you said in particular that stuck out to me was just, I think it is so important to remind people that abortion is a relatively normal part of life. 1 in 4 women will have an abortion in her lifetime. And the level of regulation and restrictions that is placed on abortion care does not equate to how safe and how common this procedure is. So when we hear supporters and proponents of this constitutional change saying things that there will be like an unregulated abortion industry is the phrase that they love to use. I think it's really important for us to remember that one, abortion is already very regulated in Kansas. And you don't need to change the Constitution to regulate abortion care, just like any other medical procedure of similar complexity, right? So just as folks are, talking about this issue in the community and thinking about, what are the actual facts of the matter, there is no reason we need to change our Constitution and take away people's rights in order to make sure that abortion is treated just like the healthcare procedure that it is.
Dr. Ensing, did you want to add anything to that?
No, I think both of the panelists handled those very thoroughly.
Great. Well, then moving on, Rachel, are there enough service providers here in Kansas, and how have laws that have been passed in, say, Texas or Oklahoma impacted the providers and the women here in Kansas, or women here in Kansas?
Yeah, that's a great question. So are there enough? I mean, probably not. As Dr. Jones said, I mean, there are, 98% of Kansas counties don't have an abortion provider. Currently, I mean, there are 4 in the state. So there are 2 facilities in Johnson County and 2 in Sedgwick County. So if you don't live in one of those counties, you have to travel some distance to obtain an abortion. that probably, that likely is not meeting the need. Again, as Dr. Doan said, like just because more restrictions are passed and abortion becomes less accessible, that doesn't mean that fewer people suddenly don't, need abortions. Obviously, what we're seeing in Texas is very concerning. The U.S. Supreme Court allowed Senate Bill 8, which is an unconstitutional 6-week abortion ban, with a private enforcement mechanism to stand, and it has been the law in Texas since September 1st of last year. So we are seeing, countless patients from Texas coming to neighboring states. My understanding from talking to the providers that are part of our coalition is we're not necessarily seeing that huge uptick in patients in Kansas, because what people do when they have to leave their state for an abortion, people are just generally likely to figure out, okay, where can I drive to get the procedure? It's not like people are flying to a lot of places. And also, like, where do I have family? So if there's a place where they can stay with someone while they get their procedure, they will definitely do that. But we have seen, from my understanding, talking with our providers, is a lot of patients have been going to Oklahoma. And Oklahoma is currently, their state legislature is still in session, and they are getting ready to pass a Texas Senate Bill 8 lookalike bill. And given the fact that the U.S. Supreme Court has not blocked SB 8, I don't know why they would block Oklahoma's law that will be virtually identical. So as we start to see, other states pass these very extreme restrictions, I don't know where people are supposed to go, because if you can't go to Oklahoma, if folks can't go to Missouri, there are just a lot of, there are going to be a lot of people that are displaced. And the most important thing is that people can actually just access this care where they live in their own communities, and that we don't let Kansas become a state like Texas or Oklahoma, where we have women fleeing the state in order to get what should be constitutionally protected healthcare. So, at the moment, again, this has been a right and an ability to access care that has been eroded tremendously. But right now, given the makeup of the U.S. Supreme Court, given the fact that there is a likely chance that Roe could be overturned or eroded beyond our recognition, this is really the time when these state legislatures that have been champing at the bit to ban abortion for a long time really see their opening to do just that. So I hope that we can make sure that Kansas does not have the same fate as those states that are close to us.
And I just wanted to weigh in. So Lorene in the chat asked what rights other than abortion will be removed from our Constitution if this passes. I think that's a really astute question to ask. And the truth is that we don't know, because what would happen if this constitutional amendment passes is it would open up the gates to restricting all kinds of things that we associate with bodily integrity. And so again, what the Supreme Court in Kansas ruled was that the Constitutional Bill of Rights afforded protection of the right of personal autonomy, right, bodily integrity, and exercising self-determination when it comes to family formation. And so I'm sort of, rephrasing the ruling there. And I think that one of the things that I really emphasize in my work as a historian is the importance and the links between the right to not parent and the right to parent. And so I think interfering with bodily integrity and interfering with decisions that people are making about their families and their right to parent, we should be very cautious amending our Constitution and saying that's not a natural right or that's not an inalienable right that all Kansans have.
And just adding on to that, I would also emphasize we have lots of examples in the United States historically and around the world of what happens to citizens when they are either denied the ability to have children or they are forced to have children. And both of those outcomes have dire consequences, not only for the individuals who are forced into either of those scenarios, but also for society as a whole. And we don't really talk about that very much, but like I said, there are ample examples, and we have lived through these periods and moments in history and lived with the consequences of that. Certainly do not need to return to those.
I think that question also is kind of like a good segue into our next question or our next topic. And that is turning to you, Dr. Rensing, and turning back to the proposed amendment. What is the potential impact on service accessibility if this amendment passes, particularly in light of the U.S. Supreme Court's ruling or anticipated ruling on the Mississippi decision?
Yeah, so I kind of wanted to speak to what we know from the research about the impacts of abortion restrictions. So I am a health equity scholar, and I work a lot on maternal mortality issues. And so I think it might be helpful for folks on that are attending this panel this morning to kind of know that we have very good evidence-based research that shows that when abortion restrictions are passed at the state level, that both maternal mortality goes up and infant mortality goes up. And so I think that especially if you're talking to friends and family about this issue, that's something that you really might want to emphasize for folks who think of this issue as like helping pregnant people or helping babies, right? And it's not just correlation. So we know that states that are most heavily invested in regulating abortion are also the states that invest the least amount in maternal and infant health. So for instance, Kansas has not expanded Medicaid, which would in fact tangibly improve maternal and infant health outcomes. But also we know that passing abortion restrictions means that sometimes healthcare providers hesitate providing life-saving care. So we see this happening in Texas right now, where pregnant people are hopping on a plane and going to Colorado because the provider is not wanting to interfere in a pregnancy that's not viable to save a pregnant person's life, to save a pregnant woman's life. And so that has real harm in terms of maternal and infant health outcomes. The other thing that I will say is that, and as this kind of chimes in with folks asking about medical abortion in the chat, is that we know that when abortion is outlawed, that miscarriages become suspect, right? We've seen this in Latin America, and we're seeing this now as states pass ever and ever more restrictive abortion legislation on earlier pregnancies, right? So when miscarriages become sites of criminalization, who suffers, right? So especially with medical abortion, there's no way to test to see if a miscarriage was induced by medication or happened naturally. And so when a person comes in to a hospital with experiencing miscarriage, is that person going to be suspected of inducing that miscarriage? Will there be arrests made? Will there be, search histories of their internet search history to see if they were accessing some of the online purveyors of those prescriptions, right? All of that is something that we know happens when we see these really severe state level restrictions being passed. So I think for all those reasons, I really wanted to call our attention to that broader context.
If I could, I want to chime in on what Dr. Rensing is saying, because I think that it's important to remember that yes, these things have already happened, right? We have already seen women be prosecuted for pregnancy outcomes. And of course, it is always women of color and lower income women. It is not people like me who are not already targeted by the system in a lot of ways. But I think it's really important just to note for this group that in the last couple of days of the legislative session, there was a bill introduced that makes abortion a felony in the state of Kansas at any point in pregnancy, and that does not have any exceptions in its language. And that includes procuring abortion pills. So while I think whoever wrote this bill, that is probably intended to target abortion providers. That is the type of policy that, if passed, could easily be used to target, a person that is procuring those pills for their own use. So it definitely, has put folks in a legal gray area. But if we have bills that literally say it is a crime to induce an abortion, I really don't see what stops the state from, prosecuting women and pregnant people under those same types of statutes. And, for us here in Kansas, our constitutional protections at the state level are the backstop for things like that. But that is a bill that was introduced in our state legislature just this week. So these things are not, what ifs, or it's happened other places. It's not a scare tactic. Like, that's a bill that they could have considered this session, and very likely is the kind of thing that the state legislature could take up if this constitutional amendment is passed.
Or is anybody concerned that this constitutional amendment and some of these bills that they're introducing and passing in Kansas could lead to a ban on contraception?
Absolutely, because we know already from the Hobby Lobby case at the Supreme Court level that there are folks that believe that hormonal birth control is abortifacient in some cases. And so those folks see a continuum with medication abortion and hormonal birth control. And so absolutely the kinds of state level restrictions on abortions that are quite extreme that are already passing in other states. If this constitutional amendment passes in Kansas, that will open the floodgates to lots of legislation that the average Kansan will probably be shocked by. And just to kind of speak to the number of comments, yes, we absolutely need to be talking about which women and which pregnant people are going to be targeted by these laws. And I wish that our state legislature were talking more about our maternal mortality crisis, which vastly affects African-American women more in Kansas than other women. And so I love the work of the Wichita Birth Justice Society that's trying to increase and improve maternal and infant health care in this state. And they have been advocating for helpful legislation that would track our data in our state so that we can better improve and reduce those racial health disparities in maternal and infant mortality. Unfortunately, that's not where the Kansas state legislature is spending its time. But I think that there is a lot that could be done that would provide a safe environment for folks who choose to continue their pregnancies and to parent. And I think we're not doing enough of that in Kansas.
Sorry,
Sorry.
Amber. I was just going to underscore again what has already been said here, but it is definitely worth underscoring who gets targeted and how they get targeted and how they become entangled into the state and how that invites further surveillance. And we know those outcomes are not, they're not equally distributed across populations. And again, communities of color, women of color are far more likely to, to be wrangling with these issues, and also the outcomes of pregnancy as well, which has already been said, but it really needs to be underscored and how incredibly important this is. And that has not changed historically. That has been the case throughout our history. I also wanted to just add on to the contraception question as well. And as I was talking about earlier, the context in not only in Kansas, but in other states as well, how dramatically to the extreme we have become, where we have shifted what used to be considered middle ground way over to the right. So for example, in the early 2000s, in the anti-abortion movement, there was a group of activists that wanted to go after contraception. And at the time, so 2 decades ago, that was seen as a very extreme position within the anti-abortion movement, where activists said, no, we can't win on that. Contraception is too much a part of, reproductive health. It's too common in the country. We can't put that, genie back in a bottle. Now, 2 decades later, what used to be a really extreme fringe, push in the movement has become mainstream. And we are seeing that again, not only in some of these court cases that have come forward, but it is talked about openly about contraception, about banning, defunding clinics, defunding Planned Parenthood. This has just become part of the mainstream. And I think it's a really important example of how that context has shifted so dramatically to an extreme. And so, no, it does not become alarmist to be concerned if this amendment passes. What are the other implications for contraception, other medical procedures, anything to do with bodily autonomy?
Those are excellent points. And I think it leads into the next question again. So Dr. Dunn, your research really explores and concentrates on the framing of reproductive rights. What are some of the frames that have been missing in the reproductive rights movement? It's kind of a big question there.
That is a big question. And this would be a really good one for everybody to weigh in on and to talk about. One of the things that's happened over time and really is a response to anti-abortion activity successes is that in many regards, abortion rights supporters, we've kind of narrowed our focus on our messaging and trying to kind of keep things simplified and keep messages simplified. And as we have done that, we have in many regards oftentimes kind of backed ourselves into a corner. And one of the consequences of this and what we've lost is talking about the nuances and complexities of people's lives. Women's experiences have really become very flattened. One of the other issues that has to do with really focusing on exceptions. And I've said this before, abortion care is not exceptional. But one of the aspects that we have focused on is talking about abortion as an exceptional part of healthcare and really leaning into the medicalized aspects of abortion, the exceptional cases, the extreme cases of why a person would need abortion care. And one of the unintended consequences is really painting abortion as something there are people who are deserving of abortion care, and there are those people who are not deserving of abortion care, and really moving away from the fact that abortion is far more than something that should be available for these exceptional cases, that there is complexity, there is nuance. So that's one of the pieces. Also, we don't talk a whole lot about the emotions around abortion and the choices and the decisions that people have to make. Again, that complexity and nuance of life. And what that is led to is really, again, on the anti-abortion side, being able to promote these false narratives, these anecdotal narratives that become stand-ins for all people's experiences. It's also led to this proliferation of misinformation out there. For example, there's a lot of talk around post-abortion syndrome or abortion regret, that these are medical conditions, but they're not. They're also, there's no evidence that this is a systemic issue that people who have abortions face. But what it has done is it has really made a lot of pro-choice advocates move away from wanting to talk about emotion at all. And, with the concern being, well, if we talk about the fact that lots of people, not everyone, but some people have very conflicting emotions about their abortion. They have conflicting emotions about what to do leading up to an abortion, and that's okay. With any of our life decisions, and we always have conflicting emotions. That's actually rather normal. It's also normal not to have conflicting emotions, but that being afraid to talk about that has really just conceded all of that for the anti-abortion movement to insert and promote their own narrative that now stands in and speaks for everybody. So those are just a couple of the frames or the discussion that I think has really been missing. We're starting to see more of it now, but it's largely been absent. And another really, to me, important point that we've moved away from is talking about the fact that believing in abortion care and supporting abortion care is actually a moral position. Is that we have conceded this idea that the only moral position is an anti-abortion position, and that is actually not the case at all. Believing in dignity, believing in a person's bodily autonomy, their independence, those are values and moral positions as well. And I would love to see us discuss that in more detail and have that bring that into the conversation. And I will point out historically, particularly in 1960s and 1970s, abortion care and support for changing the laws and decriminalizing abortion, much of that came from a moral position. And there were many religious advocates that were involved in that. There was a religious coalition of pastors and ministers who were very supportive of abortion rights and saw that as a moral position. So I'll stop there and open it up to panelists.
I mean, yeah, I'm happy to jump in. No, I think everything you said is correct. I think that, so I'm a political communicator, right? Like my job is to win elections, and that's I think that's very true. Like whenever we're doing this, and the way that abortion has become so politicized, there's like this inherent and sort of almost unfortunately necessary flattening of the conversation, right? Because it's like, what can you put on a TV ad? What can you put on a mail piece? And the complex stories of people's lives are often not that, which is unfortunate. So I think there is like this huge need to sort of shift how we speak about this in our culture. And also, as I think about like the election that we are going into, I don't think it's the job of this campaign to like change people's hearts and minds about abortion, because we are dealing with people who have, deeply stigmatized attitudes and very like varying degrees of conflict about abortion as a moral issue. So as I think about, okay, as we do research and we figure out, okay, how do we talk to voters in the state of Kansas who probably are not on this watching this panel today and know very little about abortion? I think one of the most important things to highlight is this really is about what role does the government have in our private lives? Because we're not going to be able to get every single person with like an appeal to what I would consider to be like moral reasoning, right? Because I agree, like access to safe legal abortion is a moral imperative. It absolutely is. But for Kansans who do not feel that way, who do not understand abortion as a moral issue, except in a way that is negative, right, for abortion rights. This really is about like what power does the government have in our day-to-day lives? Why do decisions about our healthcare get to be made by politicians in Topeka instead of ourselves and our families? But yeah, I mean, Dr. Jones, 100% right. Like we have definitely ceded ground on abortion as a moral issue. And I think there does need to be a revival of that conversation because it's important. And I think that we as a movement broadly, whatever happens after Roe is I don't think that the movement as a whole is like really ready to grapple with that conversation, because we've been inching closer and closer to this place where the things that we like women across the country, people across the country have taken for granted for decades are about to be gone. So we are definitely going to have to be ready to flip the script and like find new ways to talk about this, because I think that the future after Roe or after, whatever the Dobbs decision gives us is going to be a state of being in this country that like most people are deeply uncomfortable with. So I think it's really important right now that we think about, are we ready to have those conversations about abortion as a moral good and not just, a bad option, right? For people facing a difficult choice, right? So I agree, but yeah, it's tough.
It is tough. I mean, and really in talking about these other ways that we need to think about and reframe abortion and have these conversations, there are two different pieces, right? There is what you have to do for political expediency, because that is very real. We know how campaigns work. We know how people digest information. I am saying that these conversations and this framing needs to happen over the long term. So really what we have lost in the abortion rights movement is the middle. It's people in the middle who wrestle with, or maybe haven't been exposed to, why is abortion care necessary? Why is it something that we should think about in terms of morality? And all they're hearing is the anti-abortion messaging. And so this is really part of, my mind is already looking at what does the long term look like in a country that has recriminalized abortion care, most likely in multiple states. So I absolutely appreciate what you are saying, Rachel, and I do not expect that any campaign can get to all of these nuances, but I think it's imperative for abortion rights supporters to start having these conversations and to be talking about it in a more nuanced, complex way.
Rachel, too, that kind of leads up to, you're the campaign manager for the Kansans for Constitutional Freedom, and you have done a considerable amount of work. You've led this in trying to defeat this, or this work to try to defeat this amendment. And we're talking about the different conversations we have to have with people across the state, and how we don't have to necessarily persuade them on their beliefs, but just talk about how this amendment is important, or why this amendment is important, and what the ramifications of it would be for women in Kansas and for, families in Kansas. So how do we have those conversations? Are there key words we should be using, key phrases? Dr. Ensing, Dr. Doan, you can chime in too, but I know, Rachel, you have some polling and research done here in Kansas as well. Can you talk about what we say?
Yeah, for sure. So I think one of the things that's been interesting as we have been doing our research, so we've been doing a lot of both like quantitative, so like your typical like political poll that you see where you ask people like, a binary sort of yes or no question, like if the election were today, how would you vote on this? If you heard this message, and this message, how does one's vote shift? But we've also been doing a lot of qualitative research. So we've been doing this like extensive online research. We've been doing focus groups, sort of all of the things to like start not just digging into, okay, how, when people read this measure that's going to be on the ballot, because it is very confusing. I don't know if anybody's read the quote value them both amendment, but it is not a plain language type of measure. So voters are very confused about what they're hearing. But getting past that, really thinking about like, what are the values that inform Kansans' wide variety of opinions about abortion? And so we have been trying to like really drill down on that and figure out, okay, how can we use the values that Kansans hold, of caring for one another, being neighborly, supporting your fellow Kansan. How do we use some of those to sort of start having some of these conversations about what this measure does and who is affected? And as I mentioned before, the framing this as really a matter of government interference, I think, is really important, because that is fundamentally, in my view, and my view doesn't matter because like I'm not the median Kansas voter, so it doesn't matter what I have to say, but like that is sort of the crux of the pro-choice argument, right? Is like, who gets to make decisions about our private lives? Is it the government, or is it women and their families? And ultimately, like, it is women or people who can become pregnant. I feel like I say women because that is definitely how Kansas voters like think about this issue. It is very gendered for them. And that is, I think, one of the core things that we need to get across is like, this is about more government interference. Decisions about abortion should be left to women and their families and their doctors, not politicians in Topeka. And ultimately, this measure is going to lead to a total ban without exceptions. It is going to take Kansas to a place that most people in this state will be deeply uncomfortable with, and it is going to hurt the people we love. And really just impressing upon folks that this is not the modest proposal that its proponents want you to believe it is. This is not about regulation. This is not about reasonable limits on abortion care and access. This is really about preparing Kansas for a future where there is no constitutional right to abortion and laying the groundwork for an all-out ban. And I think, again, given what we've seen the legislature already start introducing bills that will do just that. So it's really important to make sure that people understand the impact, and that, even for those of us who may not agree on abortion as a moral issue, we can find common ground, which is like, we don't all have to agree on what the decision is, but we should definitely agree on who gets to make that decision.
Does anybody else, Dr. Rinsing or Dr. Doan, do either of you want to chime in on that too, about the conversations to be had?
I think I wanted to make sure that we had some time for questions, since I'm sort of watching the clock.
Yeah. That is coming up here next. If anybody have anything else they want to add here at the end before we go into questions?
I have a thing I want to add. So if you want to talk to your fellow Kansans about this ballot measure and about what's going to be on their ballot on August 2nd, you should go to kansasforfreedom.com, and you should save the date for May 14th when we're starting our grassroots canvas launch. So Johnson County, Sedgwick County, get ready to knock doors, because this is going to take a huge ground game in addition to TV, mail, all of the above, but there's like a role for everyone to play. And one of the most important things we can do is talk to voters and make sure that people understand, one, why this issue is important, and two, that it's even an issue to begin with. I think one of the things that we always have to remember as people who are willing to spend their Saturday morning either being on a panel or coming to a panel about a constitutional amendment is that we are in the vast minority of people who are paying attention to what is going on in our politics in our state capital on the primary election. Because again, as we discussed, this is really about trying to sneak one past the goalie. So just remember that we've got a role to play, not just in persuading, but in simply educating our fellow Kansans about the fact that this is on the ballot and that they need to show up.
Whoops. Very, very true. So yes, please get engaged after this, of course. Some of the questions, I'm going to turn here to some of the questions. I'm reading through them as you're talking as well, listening. But one of the questions was, if passed, would the wording on the amendment allow the state to pass laws that coerce or force women to have an abortion? Are there any restrictions at all on what the state could pass if this law is passed and Roe is gone, or if Roe is not gone? But we're going to assume that it won't be there to protect us.
I think from a legal standpoint, this is what it means to say, actually, a right to bodily integrity is not protected by the Kansas state constitution, is that then you really are allowing state legislators to legislate and they get to decide, right, what laws then that regulate abortion or regulate decisions about birth control or regulate any decisions that's about bodily autonomy or bodily integrity. So I think that does go to the central point that Rachel was speaking about, is do we want our state government making those decisions and be the ultimate decider about what is legal or not? Or is it a more fundamental right? Is it a natural right? Is it an inalienable right for a person to be able to decide what happens to their body, right? And that's, I'll just go back to the ruling, and that was rooted in Section 1 of the Kansas State Constitution, that it's inalienable right that's connected to life, liberty, and pursuit of happiness, and that liberty includes bodily integrity. So the Kansas Supreme Court ruling was much more forceful than even our federal Supreme Court ruling that has sort of couched it in right to privacy. So.
And I would just also add to that, again, things that sound very alarmist, we don't have to look that far back in our history in the United States to see that these things have come to pass before. So to that question, yes, we've had forced sterilization, state-sponsored, endorsed codified sterilization programs of people. And these programs were targeted largely across racial and economic lines. Again, the idea of the deserving and undeserving. Who's deserving to have an abortion? Who's undeserving? Who's deserving to become a parent and who is undeserving? And undeserving typically gets defined again around racial and economic lines. So these are things. So yes, the answer to that question is yes, it does open up the door for those things. We've also had state sanctioned forced contraception on people, forced long-term contraception on people. We've had medical experiments and experimentation against people's will and knowledge. So these are not things that have never happened before. We have a long history of these things happening, and this does open that door potentially for these things to return.
Anybody else have anything to add there too? Okay, so what is the impact with, or what is the outreach to independent voters and to voters who don't traditionally vote? Like, what would you say to them to get them to turn out and vote on this?
Well, I think what's great is like we have a lot of tools at our disposal to look beyond like partisan makeup. I think there has been a lot of chatter about independent voters. There are a lot of independent voters that are part of our target, what we call in the business like universes, right? So we are looking at people on a variety of, I don't know what the right word is, the criteria, right? So like we are specifically developing like models to determine support for this measure, and really can go like a step beyond partisan targeting, which I think will be very happy because the League of Women Voters is very, very conscientious about making it clear they are a nonpartisan organization. Kansans for Constitutional Freedom is the same. So yeah, establishing voting behavior among independent voters, it is too late to do that, right? We need to get them to vote in this one election. And so for us, we are treating them as we would any other turnout voter, right? So when you have a campaign, I know probably a lot of folks on this call have worked on campaigns, but for those who haven't, like you generally think about two big groups of voters. You think about persuasion, which are people who are likely to show up and that may or may not agree with you on an issue or may or may not support in a different context your candidate, right? And then you have typically a turnout audience, which is people who are very likely to support you, but are unlikely to show up. So from what we can tell from our research so far, yeah, there are quite a few independent voters that are part of our turnout universe. Independent voters are tricky, I think, for a lot of reasons, because we sometimes tend to incorrectly think of them as like middle partisans. Like they're people that are moderate, and generally they're just people who aren't super engaged in politics or the process. So to reach independent voters and really any low turnout voter, it just takes continued communication through a variety of means to like get them to show up and to formulate that behavior. So that's definitely part of the equation. But I don't think they necessarily need like a specific strategy. There's been lots of conversations. People are like, should we call it a special election? Should we call it this? It's like, we need to tell people what day the election is and do everything, in our power to get them to show up. So, as soon as we are through the persuasion phase of this campaign, we will be making sure that those people are part of our GOTV, our Get Out the Vote program, just like any other voter in the state.
We have time for probably a couple last questions. One of them is, if this amendment passes, do you think that the Kansas legislature will immediately take away people's right to freedom, reproductive freedom? Will that be their first order of business coming next January, or?
I mean, I do think that you can just look to Texas and Idaho and Oklahoma and see what's coming. The only thing that is preventing that coming through our state legislature right now is this Kansas Supreme Court ruling that affirms what's in our Constitution. So if our Constitution is amended, we should expect to see a wave of very restrictive abortion legislation. And again, I think to folks in the chat who are asking how to speak to the value them both framework, I will point you to research that demonstrates that when abortion is restricted in a state, state levels of maternal mortality and state levels of infant mortality go up. So if you care about maternal and infant health, I think there's a very strong case to be made that making sure that abortion is safe and legal, and that the full range of reproductive choices about families and family health and well-being are safe and available and legal, that is valuing them both, that expanding Medicaid is valuing them both, that raising the minimum wage and helping people make decisions about when they are ready for another child in their family, right? Because most people who choose abortion are already parents, that is also part of this conversation. And I think that all of that is sometimes missing when we're sort of talking about the narrow stakes of these political battles.
Okay. Finally, if you could leave like the audience with one thought, what would that be? And what do you want them to know about encouraging other people to vote right now on this?
If there's one takeaway, Rachel already said it, which is to vote, but also to bring your friends to vote, bring your family to vote. One of the biggest things that we can do is just simply ask and remind. It's a highly effective way to increase voter turnout. And so I would just encourage everybody to do that, to make sure that not only are you going to the polls, but bring somebody with you or encourage them to go with you.
Yeah, I guess I would say that Kansas voters have a lot of power this coming August, right? We get to decide what the future of our state looks like. We either get to be a state where abortion is safe and legal or a state where it isn't. There's not really a middle ground in this fight that we have coming up. So I would just say, like, use that power wisely and definitely talk to your friends and family. Try to get over any anxiety or fear that you may have in having those conversations. As Dr. Doan mentioned, like, there is a lot of stigma that comes with not just being one of the 1 in 4 women that's had an abortion, but, you know, being a person who supports abortion rights and talking to, you know, your friends and family. So I think that it's just important to remember that there are probably a lot more Kansans that feel the way that you do about this issue than you may realize. So, you know, take a leap of faith and have a conversation with someone, even if you're not 100% sure how to start it, or you don't know exactly how they're going to respond. Like, it could be worth having the conversation and, you know, let your fellow Kansans surprise you. You would be surprised how many people are out there that understand the importance of reproductive freedom and will be very open to talking about issues that we don't really get to talk about a lot. So give it a shot.
We can give Susan a second to get back on here, but finally, I just want to say, go over, you know, you also brought up getting involved with Kansans for Constitutional Freedom. I'd like to encourage people to go to the Kansans for Constitutional Freedom website. If you want to give that one more time and sign up to get involved, which they can do on the website, I believe.
Yeah, I'd be happy to. So it's Kansans for Freedom, for freedom.com, and save the date for May 14th. So that is when we are doing our grassroots canvas launch, and we'll be knocking doors all over Johnson County. So we'd love to have you. And if you can't knock doors for any reason, we'll also be doing, you know, we are continuing to do phone banks and other types of voter contact for people who maybe can't do a door knocking shift. So there are lots of ways to get involved, and those are going to be ramping up significantly after the big launch on the 14th. So I hope to see you all there.
Sounds good. With that, I will turn it back to the League of Women Voters, to Dr. View and Connie Taylor. Or Janet.
I'm going to hop in here. Thank you, Amber. So one of the quotes that I jotted down was, "We may not agree on what the decision is, but we can agree on who gets to make the decision." And that goes back to getting to the polls, casting our votes so that we can be the one to make the decision. So thank you, Amber, Dr. Rensing, Dr. Doan, and Rachel for helping us better understand the amendments that Kansans will vote on in the August 2nd primary. Now, and we also, our hope for all of you attending is that you will use what you learned today to inform your conversations with your elected officials and your decisions at the ballot box. Next, I'd like to introduce Janine Lenane, who is part of our Diversity, Equity, and Inclusion team. The League has embarked on a journey encouraging people to increase their understanding of equity, diversity, and inclusivity, and examining their own power and privilege. Today, Janine is going to present a DEI moment. Janine, I'll turn this over to you.
Okay. Hello, everyone. And so, honestly, I feel like our panel has done an amazing job naturally focusing the lens on what we are talking about. And if you don't know, you've probably heard us talking about the DEI lens a lot, and it is a way of focusing our attention on how policy and procedures affect other different groups. And so it's a way of highlighting where there might be pain points that we individually might not see, but other groups might be experiencing. Hi. So, and also introducing my daughter, Ash. Sorry about that. But so when we are talking about reproductive issues, this is something, as the panelists said, access to reproductive health services, including abortion, disproportionately impacts low-income women, including women of color. Women of color often have limited access to health care and health insurance, which leads to limited access to birth control, which leads to more unplanned or higher risk pregnancies. As you heard, the laws also can require somebody to end up, it doesn't require, but it effectively makes it so people need to travel, which means taking off time off work, finding a place to stay, paying for the travel. And if you are low income, which disproportionately because of systemic racism tends to be women and people of color, that is a harder thing to do. And so all of these laws and restrictions that are trying to be passed, while they affect all of us, some people they affect more than others. And so while you are working on this issue, that is something to keep in mind, that this isn't just what you are doing for yourself or someone like this who's too young to worry about it yet. But it's also other people in our community that would have a harder time working. So if you look at this and say, well, that doesn't affect me, that's true, but it does affect other people in our community. You will find more resources and links. They were in the voter guide that went out and in the follow-up email to this meeting. Thank you.
Thank you, Janine and assistant.